Pereira, and I'm a professor, researcher, and head of technology at the National Health System from Brazil. And I'm here to present some part of my studies about pharmacopollution and the widespread use of medicines and how it affects public health and the environment. First of all, I would like to explain that medicalization, medication, biomedicalization, there are many concepts about the widespread use of medicines through our society. We have the phenomenon of medicalization when we have many of the human conditions translated into medical conditions, so they can have some treatment. As we say here, the label use and off-label use, to be more clear. The biomedicalization that are personalizing the treatments for us, and it brings us a lot of advances in public health, but also brings us a lot of use off-label and undesired use of medicine through society. Just for example, when we think about the widespread of use of medicines for society, and not just for rational use, just not for the use the medicines are prescribed, we must remember from the case of US. I have some the latest data took from the FDA, as we can see that the percentage of the person that use at least one prescription at the past 30 days is at least half part of the population in US, and using 3 prescriptions is 24, and at least 5 is 12. So the US society show us how much medicine the society consumes and how this technology is important. It's widespread used. Just to bring some data, the number of the prescription provided through the physician office visits, it's around 1 billion. And the most frequently prescribed therapeutic classes are analgesics and other classes of substances. But it's quite interesting to see that analgesics are the most prescribed, also in hospital emergency. And this widespread use of medicine will bring us a lot of use from the household budget to buy medicines, and especially in developing countries such as Brazil, the household budget is strict. So the money people use to spend with medicines and with food compete in many situations. As we can see here, the amount of daily doses used through the countries and the regions is increasing and will be even more. So we are not even on the top of this phenomena of widespread use of medicines, not just for what they were meant for, not just for label uses, because here, as we can see, is the all consumption. Those data came from the IQVIA Institute from 2023. It's interesting to see that on top 10, Brazil, it's one of the biggest pharmaceutical markets in the world. And we here have a widespread use of medicines even bigger. So Brazil is today the number 8 in ranking from the pharmaceutical market. And we are still a developing country. It brings us a lot of pressure from the pharmaceutical industry, especially on national health public system. This phenomena of widespread use of medicine, not just for label uses, but also all off-label uses and inappropriate uses, such as when people use some medicine for hyperactivity to increase focus when you are not have hyperactivities. And it's a phenomenon that is happening in Brazil a lot. So, this use of medicine brings us the phenomena of pharmacopollution. Pharmacopollution is a health and environmental consequences from the dispersion from the active pharmaceutical ingredients and ADC through environment. And it's quite challenging because, as we can see, based on the study on the screen, that the insufficient data about this dispersion, about how amount of pharmaceutical ingredients are really dispersed through environment, it's a real challenge to assessing this risk. The latest the studies of these consequences and this dispersion were made through the latest 30 years. So it's almost understood phenomenon. The long-term exposition to these low concentrations of API through environment and the combination of those low concentrations of APIs through environment and its consequences to human life are still uncertain, I must say. But for environment, as we will see on the following slides that show that environment consequences are already known. As we can see this image on screen, the most important source of pharmacopollution, or the origin for API dispersion through the environment, are the households. The household generator, the patient that is taking pills and taking its medicines at home. And we consider the billions of households through the world, and that many of the houses are not safely and efficiently connected to the sanitary system, brings that phenomenon. As the main path is the household patients, as we can see on literature, and especially through all the pathways that are not the proper way to take back it to the pharmacy for a proper disposal. But many of people let them forget at home, and sometimes they litter on improper ways, such as the common garbage or the sink or the toilet seat. And the other sources for this phenomena are the livestock and aquaculture, the pharmaceutical industry, the healthcare facilities. But as we can see on literature, they are not the main sources for API dispersion through the environment. The main source, as we can see on literature, are the household generators, or the patients that use medicines at home. So, considering the main source of pharmacopollution or the household generation, we must split the concept of household medicine waste from the healthcare waste, because healthcare waste are designated to incineration and other public disposals. It's not the case for all the household medicines. And household medicines are a class of pollutants and the same group of steroid hormones and industrial chemicals and pesticides that we use at home, and also can reach the environment. Some studies of household micropollutants also expand the pharmacopollution to other class of micropollutants, such as organic effluents, PPCP, metabolites and ADCs, illicit drugs, and trucks. So they also reach the water bodies and the environment. So they classify this dispersion of API through environments as the same group for study organization and theoretical and analytical improvement. Also, the household waste medicines, or as the what is left, so what will not be consumed, the leftovers of medicines, and its phenomena of pharmacopollution, as we can see on literature, are split into three areas: that the dispersion through environment and its removal treatments, the effects of the API through environment, and the relationship of the society with the use of medicines and the distortions of the rational use. The leftovers are usually generated when patients have some part of the amount of medicines he will not need. So when we have the rational use, it's not expected to have a leftovers or out-of-date medicines and the discharge, because the rational use will prescribe the right amount to the patient. So some countries, as Brazil, we do not have a customized amount of medicines for the patients. We have standardized quantities for everyone, mostly. So just here in this example on screen, a patient that needs a use of antibiotics for 7 days, 2 pills a day, will need 14 pills, but is often found here on pharmacies 20 pills. So it's expected 6 to be leftovers. The main reasons for leftovers and this amount of out-of-date and leftovers of medicines at households are the non-adherence to the treatment, therapeutic obsolescence, the suspension, interruption, and all the changes from the therapeutic prescription and plan. It's important to remember that not all leftovers are off date. Some countries do not allow the donation of leftovers because of the safety, but some authors argue that to decrease the effects of pharmacopollution, especially in countries where the access to medicines are more restricted, the donation could be alternative. As we can see on the map, the blue dots are contamination of API in surface water, the orange in tap water, green underground water, purple on sewage, and green contamination to animals. As we can see on the top of the screen, some animals are affected to kind of APIs as fluoxetine, estrogen, and ciprofloxacin that affects masculinization, food intake, and weight growth. Just to start, the destinations of those leftovers, as I say here as AGWM, are not the take back to pharmacy as the main destination, unfortunately, outside of Europe. Here in Brazil, it's not still the main option to take back. All the unpopular ways are still used often. Brazil, it's quite remarkable for those studies because we have 3,3 to 10,000 pharmacies to inhabitants. Meanwhile, World Health Organization recommends 1. So it's easier to find a pharmacy than a school or a supermarket here. It's cultural. We have a production of 56.6 grams per capita by year of this generation, of the amount of generation. And it's interesting that it's higher than, for example, Spain and Denmark. It's about 10,000 tons by year. And it was just mandatory, the reverse logistics, since 2010. As we can see, the consolidated data from the latest data we have, the amount of collection of those leftovers and the home pharmacy, as we say, because once it's very easy to buy medicines here from analgesics and many kind of other medicines that are needed a prescription worldwide. Here it's really easy to buy, and it brings amount of recoil. It's just what was recoil for the take back program, and it's just 261 tons. So the many part of there are litter or throw to the sink or the toilet seat. As we can see on the screen, the pink, red, orange, and dark orange color on the screen are improper dump fills and other landfills that are not prepared to receive the household litter, the waste. So the leftovers and all the medicines that the people in that area are assigned will throw those medicines, and probably they will reach the ground and the water easily because of the improper destinations we have in that main spread area. So consider this scenario, and the most important thing to do whenever you are is to take back